Hello, it's just 1 minute to get on here and then we'll get started. Thank you for joining us today for our WellCares Basics, What Providers Need to Know webinar. My name is Sam, and I am the WellCares Fund Communications and Marketing Manager. I'm joined today by Sebastian. If you want to go ahead and introduce yourself.
Yes, I am Sebastian. I am the Outreach and Language Access Lead.
And Allie.
Thanks, Sam. Hello, everyone. My name is Allie LaFontaine, and I am the WalkCares AAA Manager here at DSHS.
And Katie.
Yeah, my name is Katie Kelnhofer. I am the Provider Policy Unit Manager at WalkCares.
And Pete.
Hi, my name is Pete Keller. I'm the Provider Network Operations Administrator here at WalkCares.
And today we do have some staff members from the Department of Social and Health Services and HCA in the chat answering your questions. And then we will also have a live Q&A section later in the webinar. Anyone who has joined using a computer or using the Zoom app on their phones can submit questions through the Q&A function at any point during the presentation. If we're unable to answer your question during the allotted amount of time, we will email a response to you with the email you registered with. This webinar will be recorded, and the recording along with the slides will be available on our website at wellcaresfund.wa.gov/webinars within 24 hours of the completion of the presentation. And now I'll pass it along to Sebastian.
Why a program like WalkCares is needed. And starting with that, the way that we have paid for long-term care up until now isn't working. So even though 70% of us will need long-term care at some point in our lives, most of us can't afford it. The cost of 20 hours of home care per week is just over $23,000 for 6 months. And other types of long-term care are even more expensive. But the median household income for Washington seniors is just $69,000 per year. And in order to fill that gap, right, that's where family caregivers step in, could be either with their own savings or also by providing unpaid care. Almost half report a related financial setback and spend on average 25% of their own income on those care expenses. Many also have to leave the workforce early to provide care. So caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits. And businesses and the economy are also impacted, right? So most caregivers work full time, and 61% of working caregivers say that their care responsibilities have impacted their job in some way. So that could be maybe having to come in late, maybe leaving early more often, reducing the amount of hours that they work, or turning down promotions, right? Quitting even and retiring early. And we also know when a working caregiver leaves their job, it can cost 1.5 times their salary to replace them. So to earn benefits, you automatically contribute 0.58% of paycheck during your working years, and you only contribute while you're working. So contributions stop when you retire or become unemployed, and everyone is covered at the same low rate regardless of pre-existing conditions. Starting in May of 2026, next year, we will be able to apply for benefits, and you'll need to meet a contribution requirement and a care needs requirement, which we'll talk about shortly. Once approved, you get to choose how you want to use your $36,500 benefit. It is a lifetime benefit, and that amount grows with inflation. And you can choose any of the covered services that you want, which again, we'll talk about throughout the presentation. And there are no out-of-pocket costs when you need care. So we pay the providers directly for the services that you receive with no copays or deductibles. So everyone who is contributing to the Walk Cares Fund more than 500 hours per calendar year is earning benefits, and that includes part-time and temporary workers. So in order to qualify for benefits, you have to meet, as we mentioned, right, the contribution requirement through one of these three pathways. We have on the left-hand side there the permanent pathway. So this pathway will earn the full benefit amount by contributing for at least 10 years. Then we have the temporary pathway, where you can earn the full benefit amount if you have contributed for at least 3 of the last 6 years at the time that you apply for benefits. And then we have the transition pathway, which is lifetime access to 10% of the full benefit amount for each year that you contribute. This is for the transition pathway is specifically for folks who were born before 1968. And these workers can also earn the full benefit amount if they qualify through another pathway. So for example, right, someone who worked and contributed at least 500 hours per year for 2 years, if they were born before 1968, they would earn 20% of the full benefit amount, which is about $7,300. And just to get a sense of what contributions look like over the course of a career, right? We said 0.58% of every paycheck is the contribution rate. So a typical worker in the state of Washington earns about $59,000 a year. So in a month, they contribute $29, and that adds up to just over $10,000 over a 30-year career. And to earn less in benefits than you contribute, right, you'd have to make an average of $210,000 each year for 30 years. So once we just covered the contribution requirements, right, and we'll talk next here about the care needs requirements. So to use your benefits, we must determine that you need help with 3 or more activities of daily living, and will continue to need help for at least 90 days. The activities that we assess are bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. And if an applicant requires supervision with an activity of daily living due to cognitive impairment, so monitoring, queuing, or setup assistance, that counts as needing support with that activity of daily living. And that way, this ensures that our eligibility process captures not only frail individuals, but also people with cognitive impairment. So when you're ready to apply for benefits, you'll start by creating an online account. You can have someone else help manage your account as well. And additionally, your local area agency on aging will be available to support you if you need additional support. Once you submit your application, we'll confirm that you've met the contribution requirement. Then you'll be able to schedule an appointment to talk about your care needs. And after we meet with you, we'll let you know if you're approved to start using your benefits. Then once you've been approved, you can use your benefits to receive any covered services and supports from a Walk Cares provider. I know Ali will be speaking to this as well in a little bit, so I won't go too much into detail here, but just to get a sense of what the whole process looks like. So you may want to choose services to help you stay in your own home, right? That could be in-home care, home modifications, home delivered meals. We also cover many services that support family caregivers, so you can get paid care from a loved one, including your spouse, or get respite care so they can also take a break. You can choose to receive services in your community, so things like adult family home or adult day services, or you can choose to receive care in an assisted living facility or nursing home, and that includes memory care. So you might be wondering how far the benefit amount will go. About a third of people need care for a year or less. So for those people, depending on the services that they choose, Walk Cares may be able to cover all or most of the care that they need. For others, Walk Cares can provide your family with immediate relief and time to plan for future care costs. So these are just some examples of how someone could use their benefits. If you'd like to pay a family member for care, for example, you can receive care for 10 hours per week for 2 years and get care supplies for under $35,000. If you want to make your home more accessible to be able to keep living there independently, you could make home modifications, install a personal emergency response system, and get meals delivered for 3 years for just over $36,000. And maybe if you need short-term help after an accident, you could get in-home care for 20 hours per week for 6 months, install a ramp, and buy safety equipment for less than $29,000. And before I hand it over, starting in July of 2026, you can choose to continue participating in Walk Cares if you leave the state. So to become an out-of-state participant, you must have contributed for at least 3 years, again, for 500 hours or more per year, and must opt in within a year of leaving Washington. So just like other workers, out-of-state participants will keep contributing to the fund during their working years. And we are working on a process for out-of-state participants to be able to report their earnings and pay premiums. And of course, the focus on making it as easy, right, for those folks as possible. So starting in July of 2030, out-of-state participants will be able to access those benefits outside of Washington. And I will hand it over to Allie.
Thank you, Sebastian. Hello, everyone. Again, my name is Allie LaFontaine, and I am a manager here at Walk Cares. I'm going to walk you through a high-level overview on how to become a Walk Cares provider. This is a 3-step process. So first, the providers must apply and meet the minimum qualifications. And then step 2, providers will be entering into a contract either with DSHS or their local area agency on aging, or called a AAA, depending on the type of service and the location. Step 3, DSHS will issue the provider's official registration. And I just wanted to mention that it is important to note that while either DSHS or the AAA may handle tasks like processing your applications, managing your contracts, monitoring the providers, DSHS does hold the authority alone to issue and terminate provider registration. Next slide, thank you. So there are 19 covered services and supports that are included in the Walk Cares Fund benefit. These benefits will be available to eligible beneficiaries starting on July 1st, 2026. DSHS is responsible for contracting the following services. So we have adaptive equipment and technology, adult family homes, assisted living facilities, care transition coordination, in-home care, personal care, and respite care with CDWA, known as Consumer Direct Care of Washington, individual providers, memory care in assisted living facilities, nursing home, professional services, specifically those in nurse delegation and private duty nursing, and respite care in adult family homes and assisted living facilities or nursing homes. And next slide. The AAAs are responsible for contracting the following services, which include adult day health services, which is adult day services, which is adult day care and adult day health. Dementia and behavioral supports, these are community-based. Education and consultation services, environmental modifications, home delivered meals, home safety evaluations, in-home personal care and respite care for home care agencies, personal emergency response systems known as PERS, professional services, specifically skilled nursing, and services that assist paid and unpaid caregivers, specifically housework and errands, yard work and snow removal, and transportation. It's important to mention that if a provider does choose to serve the entire state rather than serving a specific AAA or county or region, DSHS will hold that contract. And I'm going to pass it to Katie.
All right. So one of the greatest tools that providers can use if they are interested in becoming registered for the Walk Cares program is to check out the provider application details documents that we have posted online at our provider toolkit. You'll see the screenshot there, and we do have one document for each of our covered or approved services. In those documents and on this page, you'll find the service definition as well as the minimum qualifications to provide that service in Walk Cares. There is a list of the documentation that you'll need to submit when submitting your application. And there's also a client service contract, a sample contract that providers can look at to see what language is included. I will preface that those contracts include the primary service as well as any other subcodes or sub parts of that service that are included. So it is an extensive document. So we definitely encourage people to check that out to make sure they're aware of what the expectations are and to be prepared when they submit an application. Next slide. I'll pass it to Pete.
All right, I'll talk about the application process, and essentially the provider will apply through an online form. There's no paper application. It is routed to the appropriate agency via the system that we use. Be ready to respond quickly because requests for more information from DSHS or AAAs must comply within 30 calendar days or the application may be denied. You can withdraw your application at any time. And contact info is available to request assistance as well. And you can reach out via, our customer care unit or via a chat function, email, or telephone. Next slide. If an application is denied, you will have administrative hearing rights to appeal. Information on requesting an appeal are provided in the denial notice sent to the provider. You may be able to reapply depending on the reason for denial. There are certain things that are permanent disqualifiers, such as failed background checks with barred offenses or substantiated findings. Contracts terminated for cause or default with DSHS is another disqualifier. Next slide. So through DSHS and AAAs, you will be contracting. There's a difference between contracting and registration. Contracting is the next step after your application is approved, which is essentially where your minimum qualifications are reviewed, your background check is run. You'll receive a new client service contract for you to sign. The contract length is either 2 or 4 years, depending on the service type. Service types with standard 4-year contracts can sign a 2-year contract instead if they wish, but you can't extend if standard is 2 years. Registration is the act where DSHS officially registers a provider once a contract is complete and you receive your registration number. You must have a valid contract to be registered with Walk Cares. You will be removed if your contract is terminated or ends and you hold no other valid contracts with Walk Cares. And you will automatically be added to our Walk Cares Fund Provider Directory. Next slide. Okay, so requirements for registration. You must comply with all service-specific statutes and rules, federal, state, and local, comply with background check requirements, meet minimum qualifications, and must hold all current licenses, credentials, certifications, trainings, and other requirements for your particular service type. And you must meet insurance requirements, which are aligned with Medicaid, and not have a contract terminated with DSHS for cause or default. Next slide. All right, this is the Walk Cares provider directory. There are no case managers, so beneficiaries find and contact providers and form that relationship and agreements with them. Online Walk Cares provider directory will be available January 2026, and it'll be hosted on the Community Living Connections or CLC website. In your listing, you'll have your name, the services you provide, contact information, and additional languages that you offer. And so this will be an updated look and feel compared to the former Community Living Connections page. So this is a good example of what it should look like in the near future. Next slide.
Okay.
All right.
So, to talk about rates, beneficiaries and providers are going to need to agree to the terms of service as well as the rate. WalkCares will pay or pays the within your usual, customary, and reasonable rate range up to the maximum rate for that service. DSHS will maintain a rate sheet, which is available online and is published to the provider toolkit. Next slide. WalkCares will be utilizing the ProviderOne system with the Healthcare Authority. This will be used for pre-authorizations for service as well as for claims for payment. Providers will be enrolled automatically if you don't have an account after you are registered with the program. If you already do have a ProviderOne account, the WalkCares menu will be automatically added, and you'll be able to access that after you've been registered with the program. Next slide. So pre-authorizations are a big part of what providers and beneficiaries will need to work on together and agree to. Providers cannot begin providing services or billing for services until a pre-authorization is approved by the beneficiary. So it is the beneficiary's responsibility as well as the providers to discuss the rates and the services that they'll be receiving before drafting that pre-authorization. The provider will be the one responsible for creating that pre-authorization in the ProviderOne system. And once doing so, the beneficiary will receive a notification in their WalkCares account. They have up to 30 calendar days to take an action on that pre-authorization, and it must be approved by the start date. If they take no action, it will time out and the provider will need to resubmit a new pre-authorization for them to approve. Our pre-authorizations are good for up to 90 days, except for two of our services, specifically care transition coordination. Those pre-authorizations can only last up to 60 days, while environmental modification pre-authorizations can last up to 6 months. If a provider is going to be offering or providing services beyond 90 days, they will need to submit more than one pre-authorization, or they'll need to submit a new one when that first pre-authorization period has ended. And claims for payment are going to be submitted in ProviderOne for processing. In WalkCares, providers must submit the claim with no errors by 60 calendar days from the end date of the pre-authorization. And you kind of see some of our data here pulled from the ProviderOne system, reflecting that 97% of submitted claims are done in that first 60 days of service. We know that this is different from other programs, but it's very important that people know the 60-day requirement for submitting claims in WalkCares. Claims that are submitted after this deadline will be denied and the funds will be returned to the beneficiary's balance.
Thanks, Katie. On to me. So on this slide, we'll cover the key areas currently included in our WalkCares provider rulemaking. Current provider rulemaking topics include approved service definitions, requirements to provide approved service, provider registration and discontinuing provider registration, payment and reimbursement for approved services, administrative hearing, notice of department determinations. Approved service definition requirements to provide approved services and provider registration and discontinuing provider registration rules went into effect on September 22nd. And payment and reimbursement for, looks like we have okay, there we go. Payment and reimbursement for approved services, administrative hearings, and notice of department determination rules went into effect on October 27th. If you'd like more information on the following and any statuses of any rules, please go to our walkcaresfund.wa.org/rulemaking. There you can also sign up for our newsletter by selecting rulemaking. For finalized rules, see Washington Administrative Code or WAC Chapter 388-16. Next slide, please. So pilot. So some providers may have the exciting opportunity to be a part of a pilot to provide services before the full launch of WalkCares program. WalkCares is launching a pilot program from January 6, 2026 through March 30th, 2026 in the following counties: Lewis, Mason, Thurston, and Spokane. If you're a provider and provide services in one of these counties, or if you choose to be a statewide provider, you may be eligible to participate in these pilot areas. Pilot providers will be prioritized for application processing. Providers selected for the pilot can begin delivering those services starting on January 6, 2026. And all other providers will begin service delivery when the full program launches, which we know is on July 1st, 2026. And next slide. So here is a high-level overview of some major milestones that providers might want to know. On October 1st of 2025, we began the applications for all providers, so application open for all providers. On January 6, 2026, as I just mentioned, the pilot will begin in Lewis, Mason, and Thurston and Spokane counties. On May 18, 2026, beneficiaries can begin to apply for benefits. And then July 1st, 2026, all providers can begin services and beneficiaries can start using their benefit. And that's all for me. I'm going to pass it back to Sebastian.
Thank you, Allie. All right,
Thanks.
so I think, yeah, go ahead, Sam. I think we'll start
Yeah,
Q&A.
so we're gonna start with our Q&A portion of the webinar. I see some of you are already asking questions here in the chat. Feel free, or in the Q&A function, please continue to do so. I will also ask some questions that were submitted on the registration form. So the first question is, I think, Pete, is the CLC page live and is the link ready for people right now?
So it is not live yet. The provider search function for walk cares will be made available in January 2026. There is a CLC page, but it is still the older version. The webpage has been updated across the board, so the look and feel of the resource guide for the CLC page will be updated, and it will align with the look and feel of WalkCare's page as well. So the CLC page is available just for the resource for the HCS version of it, but again, WalkCare's won't be available until January 26th.
And then I think, Katie, this one might be for you. Do we have to get a background check right away to work on the program?
Yes, well, so the contract signatory and or agency owners do need to have background checks completed as part of the minimum qualification verification. As far as staff that work at the agency or staff that work at for the provider, those background checks are the responsibility of that provider. They will likely be monitored to that because that is a contractual requirement that all of their staff meet the background check threshold and requirements. But yes, there is a requirement for the contract signatory and or the agency owners, if they are different people, to complete those background checks at the start as part of the minimum qualification verification.
Thank you. And then, Katie, I think this one's also for you. How will pre-authorizations be handled? Again.
So, so the pre-authorizations are going to be created by the provider in the ProviderOne system after consulting and agreeing with the beneficiary on the rate and terms and duration of the service. And what will happen is once it is submitted officially into the system, part of that will require the provider to verify that the beneficiary has the funds available to cover the entirety of the service at the rate identified. But the beneficiary will receive a notification in their user account for the program, which providers will not have access to. But beneficiaries will be prompted to go in there and look at the details of the pre-authorization and approve or deny it. That is why that conversation and that agreement is so important, so that the beneficiary is not surprised or questioning the details. And once they approve that, the provider will also receive a notification that the beneficiary has approved it and that they have been approved to start services based upon the terms of that pre-authorization. As I mentioned, if someone is going to provide services for more than 90 days, a new pre-authorization will need to be created to cover anything beyond that first pre-authorization of 90 days. So, and it's those pre-authorizations that will be used also for, substantiating the claims and making sure that the amounts that were identified and approved in that pre-authorization match the amounts that are being claimed by the provider.
Then if a provider holds a contract with a AAA already, are there different steps that they need to take?
So if a provider has a contract with a AAA currently for another program, they will need to apply for WACARES and they will need to have a WACARES contract. There are a lot of things, if they're known to the AAA already, that will hopefully make the minimum qualification verification easier. But with WACARES, you are required to complete a new application as well as a new contract, separate from any other contracts that you may have with the department or with a AAA.
And then how does a provider know which qualifications are required for all the staff and which ones are required for just the signatory?
Absolutely. So the contract signatory and agency owner identification is kind of down to who submits the application. Sometimes the person submitting it will be, someone who has the ability to sign, and other times, excuse me, it will be owners. Our background check rules are the only rules that identify both the contract signatory and the agency owners as requiring a background check. All of the other qualifications and requirements are more specific to the provider or the agency as a whole. The background check is the only one that is specific to those individuals.
Thank you. And then how long is the process from submitting your application until you're registered?
I will give that one to Pete.
So I think, what do we have written down that we have to turn around the application? I think it's upwards of 90 days, but the application, the hope is that we'll be able to turn it around in a shorter time than that. But, honestly, we're getting up and running. We're just starting to contract now in the pilot areas. And that's something we might have more of an answer for down the line as far as actual time frame. But, at a maximum, it can take 90 days.
Then I see some questions about the slides for this webinar. As I mentioned earlier, you can find it on our website at walkersfund.law.gov/webinars. It should be available by the end of today. And then, this question is, the pre-authorization covers 90 days. So if it's good from July to September, when does the 60-day billing window stop?
I see Todd. Oh, go ahead, please, Todd.
Yeah, hi. Todd Edmonds here, ProviderOne Operations Manager. So the timely filing is calculated against the last date of service on that authorization. So if it's good through September 30th, you've got 60 days to submit claims related to that authorization. You beat me to it. I was just trying to type the answer, but these are coming fast and furious.
I know, I read it and then I saw that you were typing. Sorry about that.
No worries.
One question, will reimbursements be available?
So there are going to be limited options for reimbursements to beneficiaries for specific items. That will not be available until full launch in July of 2026. And the reimbursements going to be allowable for transportation as well as for adaptive equipment and technology. Beyond those two services, we are not identifying any other services that are eligible for reimbursement for providers, or pardon me, for beneficiaries.
There's some questions about participating in the pilot. I will put an URL to our website in the chat, and you can find more information about it there. Do any of you want to add some information about the pilot, registering for the pilot?
Well, I mean, the pilot area is limited to Thurston, Mason, Lewis, and Spokane counties. If you're a statewide provider, you can apply and register to be a provider, but only offer services within that area. The pilot's opened up for provider applications as of October 1st, and you can find the application under the provider section of our website. So we are processing and reviewing applications currently. You won't be able to deliver services until after January 6th, when the pilot opens to beneficiaries to begin applying and become, be assessed and participate in the program.
Perfect. How will a provider be able to verify, Todd, sorry, again, I'm so quick, beneficiary available funds?
Yeah, no, I figured you were going there next. So within the provider portal, within ProviderOne, there will be a menu item to do a WellCares benefit inquiry. That will allow you to submit information about the beneficiary in order to determine eligibility as well as available benefit within the ProviderOne system.
Thank you. Pete, this one's for you. How will a provider get added to the directory, and how will a beneficiary know who to reach out to?
So the provider, once they have a countersigned contract and are registered, they will be migrated to the provider search page by our contracting system, which is called ACD. So essentially, every night there will be what's called a job is run, where it migrates the data over. And so say a provider applies or is registered at noon on the 25th of October, they will be in, searchable on the 26th of October, the following day. The beneficiary will reach out to the provider. They'll go to the webpage and search them based on, service areas and service types, and they can locate providers that way. I believe there's also, and Allie, correct me if I'm wrong, there's going to be some facilitation by the AAAs in finding providers. Is that correct?
Yes, that is correct.
Yeah.
And I think the only thing I'll add to that too is we're currently in the process of getting participants as well to participate in, potential applicants and beneficiaries. So that's happening in the background as well, in those 4 counties.
Perfect. This question, I don't know, it could be Sebastian, actually, this one. Do beneficiaries have to use their entire benefit at one time, or are they allowed to use it in sections?
Yeah, so it is a lifetime benefit, and the beneficiary chooses how they wish to use it, so they can use a portion of the benefit when they have a care need, but don't need to use all of it right in that moment. The remaining portion, if there's a 12-month period after they've used a part of the first part of a benefit, you will need to do a new care needs assessment, but you will, again, it's a lifetime benefit, so you will be able to use your benefit throughout once you receive it, and at different times.
Are there requirements for the communication methods that need to be available to beneficiaries to reach out to request services or be listed in the directory? Like, do they have to have an email, a phone number, a website, and all of those things, or can they just list what they want?
So the information is pulled from ACD, and that information is collected via our contract intake form, which is what our application online is built off of. And that does collect certain information like street address, phone number, email address, fax number, different things like that. So, you enter the information that you have, and I think there's a minimum for the information that we do need to collect in order to contract with you. And that's the information that will populate the provider search page on CLC.
Perfect. That looks like all of the questions. I'll give you guys one more minute if you have any last minute questions before we move on, or if any of the panelists have any points that they want to highlight before we move on to the next section.
I'd like to just add, Sam, that if you are any of those providers that are in those pilot counties currently, or like Pete mentioned, a statewide provider, please either reach out to us or the AAAs. If you're interested in participating, we are expediting applications in those locations for a pilot. Yeah, just want to add that. Please reach out.
Perfect. And then if we didn't get to your question, or I responded to you that your question needs a little more detail, please contact us and send us an email with your question, and we'll respond to you that way. And then a few last questions. Can a pilot provider be a new agency?
If they meet the minimum qualifications, then yes. I mean, I think it depends upon, there are specific qualifications for specific services, and some of them require licensure for a specific amount of time. Others do not. So I would definitely encourage you to check out the provider application details for the service that you would like to provide, and it will include any information specific to a duration of a license or years in business, etc. If it's not listed in that document, then it is not established as one of our minimum qualifications.
Perfect. And then Sebastian, the last question is, can the $36,500 benefit be raised depending on how much somebody has worked or contributed?
I think if I'm interpreting right, raised, so the benefit amount will increase with inflation. So again, in July of next year, 2026, the full benefit amount will be $36,500. But each year after that, that will go up with inflation. So we'll see that benefit amount increase, if I'm understanding the question correctly.
Perfect. And then as soon as the webinar is over, once you close out, a survey will appear on your screen. If you can take a minute to complete the post-event survey, that would be appreciated. And then, next slide, sorry. As a reminder, today's webinar was recorded and will be available online at our website. You can also follow us on social media to stay up to date on what is happening. If you have any more questions, you can email us through our website or call one of our customer care centers. And we appreciate you all for joining us today and hope that you have a great day.
Thank you.
Thank you, everybody.
Thank you.